A femoral depth gauge is used to measure both the length and the width of the graft needed. In this left shoulder, we've identified the base of the coracoid. This is where glenoid anchor number 1, which we called glenoid anchor A, is placed. Here we're placing a 4.5 triple loaded helix anchor. Using the Nevisor portal, the second glenoid anchor B, is placed angling away from the glenoid face using another triple loaded helix anchor. Here is the view from the posterior lateral portal showing both of the glenoid anchors with their sutures now free of the soft tissue sleeve. The greater tuberosity anchors using 4.5 permatape are placed in a similar fashion as we would for a rotator cuff repair. Using the syringe split cannula, the humeral side sutures are retrieved and passed through the graft, and then it's reinserted, and this is repeated for the glenoid side sutures.
So we're going to take this as steps. We go here, and you hold steady, and now we flatten, and we flatten to make sure everything's flat, and now we pull these out to make sure they're flat. Okay, and we check with the scope to make sure that everything looks like it's not tangling. Looks very good so far. Okay, and hold on, we're going to do another step towards the joint. We'll get you here. There we go. And now we're at the entrance. Flatten, flatten, flatten. And we check again. We look pretty good. Okay, now what you have to do is we're going to make a 90-degree turn. So we set up the crystal cannula and the knot pusher to control the posterior medial corner. Now we're going to take make sure I knot on suture. So do that. Okay, now, Michelle, what you're going to do is relax this one so I can turn it like this. And then we're going to dip it in. And this one should go over pretty good. Now you're going to pull with those other sutures. Let me get my posterior medial corner. And there we go. It's starting to go. There it goes. And we should be mostly in. We're going to check and see. Yeah, we're good.
The knot pusher is used through the crystal cannula to sequentially retrieve the 4 pairs of sutures from the 2 glenoid anchors and tie them, completing the fixation of the glenoid side of the graft. The humeral side suture groups are then retrieved out their lateral superior portals. The suture tapes for reinforcing the graft are then secured to a separate lateral anchor. Then the suture tapes from the posterior humeral anchor are retrieved and placed in a posterior lateral position to a separate anchor, giving a transosseous equivalent technique and compression, and this is repeated for the anterior suture tapes as well. Finally, the sutures from each anchor are then retrieved and tied, giving very good medial compression. The graft is now fully fixed and tensioned to the proximal humerus. There is still a gap between the infraspinatus sleeve, which will be repaired to the graft, adding further strength to the construct. Inspection from both the posterior lateral and lateral portal show excellent coverage with this thick and stiff fascia lata graft repaired to the infraspinatus. We expect very good healing within 3 months on MRI, with patients demonstrating very low pain and excellent motion by 3 to 4 months.
Looking at our right shoulder, and show me your forward flexion all the way up. Both arms, if you would. That's terrific.